Welcome to the September South Jersey Men's Club Breakfast. We have a long program today, so I'll try to expedite as quickly as possible. At each table we have a document, it's called a forum, and you probably have received via email either yesterday or Friday, essentially the same thing. This essentially documents the major positions of the organization and what they do, and we are looking for volunteers to help us to continue doing these processes. So if you get a chance while you're eating or after you finish eating to pick a category.
Marty, you gotta talk louder, we can't hear you.
Louder? Can you hear me now? I'm talking into the mic. Right? So
it gets distorted when you talk right into the mic.
well, yeah. So
See if you can plug the power source in.
No, it's a battery.
No, if you do a power source,
It's a, just let him talk.
let me talk right. So if you get a chance, take a look at the document and please try to sign up in a particular category. Just put your name down to a particular area that you might be interested in. It could be as simple as cleaning up after we finish a meeting. So we do need assistance in the operations of our organization. And Don will talk a little bit more about it afterwards. Okay, do we have any guests here or new people? Why don't you, both of you, one of you at a time, please give us your name and a brief description.
Mike Magnus, this is my dad, Kurt Magnus, and I'm much better looking than my brother Joel Magnus. Joining today, and I live in West End.
Okay.
I'm Joel Magnus, brother of Michael Magnus, son of Kurt Magnus. He may be better looking, but I'm smarter than you.
Do we have any other guests here? Okay, what I'd like is to have the two of you lead the... you will be going up first, but why don't one of the two of you make the motzi? Now, wait, guys, before you go, why don't you two go up first along with anybody who needs assistance? And after they've gone up, then the rest of you can go up. Thank you. Okay, just we'll start with the house cleaning. Dick Knopf did something to his ankle. Can you hear me? Dick Knopf landed up essentially breaking his ankle or so, and he's going to be out of commission for, I don't know, 9 weeks, 10 weeks, whatever it may be. So you're not going to see his happy face for a while. But, so I'll take some of his duties, and that's to hand out name tags for new people. I also want to mention that Mort Pomerantz is also in Lionsgate. He had his hip replacement removed. No, excuse me, it's his knee replacement removed. And he'll be there at least 6 weeks, and then they'll try to put a new one in. So he's been through a lot. Okay, just want to let you know a couple of things that have happened in the last few weeks. JFCS awarded the South Jersey Men's Club with the JFCS Companion Award.
What's that?
That's Jewish Family and Children's Services, if I've gotten it right. So there's a plaque over the front that we received, and we also received this from the state of New Jersey. And I just want to read just one line out of it. It says, within all spheres, South Jersey Men's Club has established a model to emulate and set a standard of excellence towards which others might strive. I thought it was a very nice thing because we do a lot for the community, and we've been rewarded by this award. Now, I'd like to also recognize the individuals who were responsible for putting up the sukkah. So everybody involved, and there should be 10, 11 of us, please rise so we can... Thank you, thank you. The Sitka teardown will be on October 3rd at 10 o'clock. So hopefully the individuals who signed up will be there to help us take it down. It should be much easier. Takes about an hour? Nah, we'll do it faster this time. A reminder, there's a food sort over at the Annex, the JCS Annex down the road on Springdale. By the time we get there, maybe most of the food sorting might be completed. If not, we'd like to have our individuals help out. And some of us will be asked to probably take some of the food over to Senator Beach's area where the pantry is. So if you can make it after the meeting, please come on down. Okay, the next thing I'd like to do is have Don talk a little bit about the forum.
Okay. When I was your president a few years back, it became very difficult for me to try to figure out who was doing what. And so I took it upon myself to create something that I called the Taskmaster, which basically outlines all of our functions as a club and who has volunteered to help assist in those functions. It has grown, I'm very happy to say, and we've renamed it to the Forum, which stands for the Functions, Organization, Responsibilities, User's Manual. Quite honestly, we're a service organization. We almost never come to you asking for money, but we do a lot of projects, and we really want you to be involved. Your name should appear somewheres in the forum on the table for doing something during the course of the year. It could be minimal, it could be a lot, depending on your involvement and your level of interest. But what makes the organization, I think, so strong is that people chip in, and a lot of little things add up to big things that are really good for the community. So while the presentations are going on this morning, please take a look at it. If your name is there and you don't want it there under what it is, cross it off, and I'll update the forum. I update it every month. If there's something that you have interest in, put your name down, and it'll be there for the next month. You'll always know which is the current one because I put the date at the bottom. So please, again, we need you to be involved. Okay. Mike?
About this forum and about the men's club, we have so many new people that it's important that you realize that we've been around for 27 years or so, and we have never had an officer or board member burnt out. Now, think about how many organizations you've been part of where you can say the same thing. The reason is everyone does something. We're not a breakfast club. If you come just for the breakfast once a month, why? You can go to a restaurant. We're here to make a difference. And when you're making a difference, you don't get burned out if everybody does a little something. We have some people where all they'll do is they'll come early and put the napkins on the table, or just sit there because their mobility's not so good and help make up a tray or something. There's all sorts of little things that can be done, and if you're doing them, that means the next guy doesn't have 3 jobs to do. So I urge you, find one or more things here. And for instance, even something as simple as the table captain who keeps track of people paying at each table for their breakfast, or making the donation, or paying their dues there. That's a job. Is that on there?
Not on there, but it will be.
So, but even a tiny little thing like that that takes almost no time means somebody else doesn't have to do it. So I urge every single person in this room, be sure your name is on there, somewhere. And if you think of some job that's not on there that could be done, write it in. Thank you.
Thanks, Mike. And a quick update on fantasy football. We're starting our 3rd week this week. My partner Stan Shumis and my son Todd and yours truly are the only winless team. We're at the bottom of the basement. Thank you. And I must say, it took very little effort on our part to get to the bottom. So we're hoping to rebound a little bit. And there are 10 teams tied, believe it or not, for second place. And our team in first place, Barry Adler, his son, and his grandson are in first place. So we'll give you an update next meeting. Thanks.
I'm going to have Ed Silva come up and talk about our next meeting, which is really not a meeting, okay? October 28th, we were scheduled to have a meeting here, and Ed will talk about what we're going to be doing instead. For people who love the Eagles, he's going to make you very happy.
All right, Giants fan. You know, this is an example of how the forum could be utilized in terms of programming, because if you notice on the forum, programming is handled by an individual, yet anybody can take over and create a program. I had 2 board meetings when I left early. One, I got a call from Rich Moskowitz the next day saying they nominated you for president. 2 months ago, I left early, and I got a phone call saying, guess who's in charge of creating the football program with Temple Emmanuel? So let me tell you what we're doing. Next month, the Eagles are playing in England. The game is starting at 9:30 in the morning. I called Temple Emmanuel. I gave them the list of all of the night games, because in the last couple of years, we've had joint programs for Eagles at night. They called me back and said, let's do the morning one instead. So we're not meeting here next month. We're meeting at Temple Emmanuel. There'll be an email going out. There's going to be a $10 charge for breakfast. They're supplying the breakfast. You now realize that our $7...
Lights on. The light's on.
So you'll be requested to respond to the email so that we can give them a head count, because they have to know how many men will be coming for breakfast. So it'll be the 28th. Report at 9 o'clock in the morning, breakfast at 9, the game starts at 9:30. We're going to do a 50-50, so we're going to need somebody to run the 50-50. They also want a few guys to come in for kitchen help, so Jay and I have volunteered to come in at 8 o'clock for kitchen. If there's 1 or 2 other gentlemen that are willing to come in and help out with the kitchen, that would be great. Okay, so go Eagles today.
Thank you, Ed.
E-A-G-L-E-S.
Eagles!
Only took 20 minutes.
Okay. Ed Stein is selling shirts.
Let me go up here and they'll holler at me. I'm modeling the long sleeve shirt since it's starting to get cool. I thought I'd wear it today, but it's really not that cool. But anyway, we have the long sleeve shirts, if you remember. They're $25. I have both large and extra large. If you need a medium or something different, I can order them for the next meeting. So let me know. I have about a dozen large and extra large today. Actually, this is a medium, so they run large, as you can tell.
Okay, Mike, would you come up here for making a presentation?
Good morning, gentlemen. We have, as you know, done the Law Enforcement Appreciation Breakfast for about close to 20 years now. And we would do a 50-50 and end up giving the proceeds split between the Hero Scholarship Fund of Camden County and the Holocaust Education Center. Well, this past year, we were able to give $250 to each organization. Well, turns out that we made too much money at the law breakfast. So we decided that we were going to give another $250 to each organization. And representing the Hero Scholarship Fund is former Camden fireman Jay Fair. Thank you. Why don't you get over here?
Okay.
Thank you very much.
Thank you. Thank you very much for your organization, donating to our organization. Provide scholarships for people who've lost their lives in the line of duty. Thank you.
Before we go into our program, I have just one more. Bernie Schuster would like to talk for a few moments, and then we'll start the program.
Good morning. I wanted to bring you up to date on some of the things that we're involved in. The VA home in Vineland, we're putting on a presentation, and I'm trying to get Jay Leno to come, and we're going to entertain the 400, 200, 300 veterans that are there. And
We can't hear you.
okay, is this working or?
Sometimes.
I'm involved in putting on a presentation at the VA home in Vineland, New Jersey, and we're going to have Jay Leno come down, and we're having Jeff Moll, whose great-grandfather did the race around the world, and he's going to put on the movie, and we're going to make the movie there, and we're going to have a bunch of other activities. The K-9 group is going to be there for the helping the veterans. This is going to be on October 1st at 1:30. If you want to go, come see me. I have room in my car, and I'll arrange for transportation back and forth. It's being held by the VA and the Jewish War veterans. The Couples Club is going to the Masonic Temple. Excuse me, thank you. On October 11th, and I'm involved in that. If you want to set something up for the men's club, we can do that. That's really neat if you haven't been there. And then I'm going to set up something for the Simeon, possibly the same day, if we can set it up, Simeon Car Museum. And then I'm involved in the October 13th car show at Moorestown. Very good show. This is a top-notch show. I'm proud of it because I won the last 3 years, so that's interesting. I drove in the Miss America parade. I got some pictures. And I drove Miss Idaho, that was a runners-up. And then we have a parade on November 11th in Philadelphia. Also, I'm involved in that. I'm going to drive a lot of veterans. So you're all welcome to come. November 4th. It's November 4th? Yes. What happened to the 11th?
Yes,
never mind.
Veterans Day. We can't do it on Veterans Day.
Never mind. Okay.
Yeah,
what are the times?
we're meeting outside the JCC at 7:30 in the morning. We have to be actually lined up for the parade by 9:30.
And how long does the parade last?
It's going to last 7 hours.
7 hours?
By the time we get there, we're not going to be back until about 4 o'clock if we go. So it's a long time.
Wow.
What, Bill?
It says you chose some Monday. Monday is Monday at Sarah's, Monday at October 1st. How can you pick a Jewish holiday to go someplace?
I don't know. I wasn't involved.
There's my expert. I thought it was the 11th.
Okay.
Nelson?
I wasn't involved, Bill.
Whoever was.
All right.
Talk to somebody.
Let's not have a revolution.
Fight.
Yeah.
Let's have a fist fight.
Okay.
I'm done. Thank you.
Thank you. Dave?
Thank you, Bernie.
Dave? Dave will now make a brief presentation and introduce our guest speaker. We have a problem?
Good morning. As you know, once or twice a year, I like to have a men's health presentation, and this obviously is one of them. I hope you enjoy it. Sheri Fort. I beg your pardon? Sheri, this thing isn't working. Sheri Fort is a physical therapist with Virtua Rehab, which is downstairs. Used to be Rehab Connection. They were purchased by Virtua, and I have utilized their services, and I find them to be very reliable, very professional. So I'm going to introduce Sheri Fort from Virtua. Please welcome her. Thank you.
My name is not Sheri, but we have a technical problem. We had a slide presentation that was supposed to be made, and because of some not having PowerPoint available on that particular PC. She will have to ad-lib this, so I'm sure she'll do a good job anyway.
We'll make it work. Sorry, guys. Well, I'm Sheri. I want to thank you all for having me, and Dave, thank you so much for inviting me. I'm happy to be here. So I went to St. Francis University for my undergrad, and that's where I also earned my doctorate in physical therapy. As Dave said, I worked for Virtua Physical Therapy, which was formerly Rehab Connection Physical Therapy, and it's located right downstairs here at the JCC. And I've been working as a physical therapist for 4 years, always with this company. We just became Virtua on August 1st. Okay, so this presentation is on the back. So how many of you, show of hands, have had back pain before? Yeah, a lot. So the reason why I think this is so important is because pretty much everyone has had back pain, has back pain, or doesn't want to have back pain. So either way, hopefully you get something out of this. So more than 50% of individuals in the U.S. suffer from back pain, and it's one of the primary causes of people calling out from work, going on disability, or just having decreased productivity. All right, so the spine. Up for auction at the end of this, okay? Whoever needs a new one. So you have the cervical, thoracic, and lumbar, and the sacrum. That makes up the vertebral column. The most common injuries are at the neck and the lumbar spine, the low back. That's just because they have more mobility. The middle of the back, the thoracic spine, is more stable. So common injuries in the neck and the low back. So I'm going to focus more on the low back just because I feel like that's the most common. Okay, so a common area where you kind of have injuries or hear of injuries is at the L4, L5, L5S1. This is because this is the area of the spine that takes the most pressure, bears the most weight, and also has the most mobility. So it's vulnerable for injury. The disc, which are in between the vertebral bodies, that gives you a lot of problems too. So the disc is like a gel material, a lot of water, mostly made of water, and the outside is a thicker layer. So the disc is important because it cushions the spine, it absorbs shock, and gives it good cushioning there. So as you age, this disc starts to lose its water content, and the disc gets smaller and smaller, which is why sometimes you feel like you're shrinking, because you actually are, because you're losing the disc's, the height of the disc. Okay. Oh yeah. So then also, on my PowerPoint, it was easier to see, but it's very easy for the disc to herniate towards the back and laterally. This is because that is the area of least resistance. Nothing's really blocking it, so it's easy to herniate that way. That's why symptoms can be either down one side sometimes of the leg. You might not have back pain, but you might have leg pain, and this could be because of a disc pinching on a nerve. Okay, so the muscles, your core. Whenever you refer to your core, you're not necessarily talking about your abdominal muscles. You're talking about your whole center. So the abdominal muscles are very important, but you also have back muscles and your hips, which are all considered part of your core. You always want those nice and strong because that's your center of gravity. That's where you want to be nice and stable. I know all of you guys have six-pack there. Insulated six-pack. Okay, so some common diagnoses or just kind of terms that are commonly used. So you hear bulging disc, herniated disc, slip disc, strained muscle, piriformis syndrome, pinched nerve, spondylosis, stenosis, sciatica. SI joint pain, and degenerative disc disease. So those are all very common terms that are all thrown around. But what do those really mean? Half of those things really mean the same thing, just a different way of saying them. Okay, so a bulging disc and a herniated disc. What is the difference? So a bulging disc is when the gel-like material is pressing out on the outer edge of the disc, and it could be pinching on a nerve. So that could cause symptoms down the legs. A herniated disc is when that material actually breaks through the structure and also could be pinching on a nerve. Both could cause symptoms down the leg. It just depends on the severity of it. Stenosis, that's a common one too. So stenosis is when the bone starts encroaching on the nerve. So that could happen on the spinal cord, right down the center here, or it could occur on the sides here. When it happens on the spinal cord, that's when you mostly get symptoms down both legs, and then when it's on one side or the other, that's when you typically have symptoms down one side or the other. So then you got spondylosis, degenerative disc disease, and arthritis. So we know how common arthritis is. Everyone has it. So that's when the changes in the spine start to form osteophytes, bone. The discs start to decrease, and you get those bony changes, which can cause pain. That can also cause some herniations in the spine, and it can just cause, like I said, the decrease in the height. And sciatica. That is probably the most common word that's talked about. So sciatica is just kind of like a general term, I feel like. That's when someone has pain down the leg, they just call it sciatica. But pretty much any time you get a nerve being pinched from the back, causing symptoms down the leg, it's like a lumbar radiculopathy. It's the nerve that innervates the legs that you're feeling, but really it's coming from the back. Okay, so some risk factors for back pain. If you have a history of low back pain, reoccurrence is very common, just because the structures are vulnerable to re-injury. If you smoke, that can be a risk factor just because it affects the blood flow. You're not getting as much blood flow to the discs, and then it loses that water content, affecting the joint. Obesity, so the more weight, the more work your body has to do to carry you around, and also generally, if you're overweight or obese, you have a lack of activity, you're not as strong, so you don't have as much muscle supporting the spine, making you prone to injury. If you did heavy physical work for many years, that can cause pain later in life, just because a lot of demands on the body. Frequent bending. So the spine is very vulnerable to injury from bending, because as you can see, that just kind of allows potential for the disc to herniate backwards. So frequently doing that over and over puts you at risk. Static positioning. So whether you're sitting for too long or standing for too long, your body doesn't like that. Our bodies were meant to move. So any position for too long, all your muscles, your spine, the joints, they're just working so hard to support you. You got to keep moving. Poor work ergonomics. So if your workstation is set up in a way that's not mechanically correct, that can put strain on your spine. Lack of physical activity, I kind of already said. And then twisting and improper lifting. This is a really common one that people get muscle strains, herniated disc with lifting. And we'll go over some lifting technique at the end. Okay, so this one, I want you to yell out what you think the answer is. It's a fact or a fiction, all right? So sciatic Sciatica and back pain are genetic. Anyone? Correct. MRI and x-rays are needed prior to evaluating and treating a patient.
Fiction.
Fiction. So a lot of times you treat based on the presentation. I know, wait, is Dr. Yorker here somewhere? Did he go? Okay. Well, we have healthcare providers, physical therapists, chiropractors. We have a very good knowledge of the human body. And a lot of things show, okay, what is this patient presenting as? What makes them better? What makes them worse? What is your knowledge of a diagnosis that they may have? And you treat based off of the response. If something is making you feel better, you go with that. If it's making you feel worse, that's telling you something. And then, if conservative treatments fail, that's when an MRI or an X-ray is needed to kind of just say, okay, let's get a clearer picture of what's going on. Is this something we need to look at further? Bed rest is often the key to feeling better. Good, fiction. If you have a herniated disc on an MRI, that is often the cause of pain. Fiction. Yeah. A lot of people sitting here have probably no back pain at all, but probably everyone has a little herniation in their spine, in the disc. Doesn't necessarily have to cause pain. A screening by a physician is necessary before starting a course of therapy.
Depends on the jurisdiction.
Correct. So in New Jersey, there's direct access for physical therapy. If anyone ever has back pain or anything, they can come to physical therapy first, and you have a certain amount of days that you can be treated. If you're making progress, you can continue without a prescription. If not, then that kind of warrants, okay, you need to be seen by a physician, depending on the insurance. This is a really good thing because a lot of times the sooner you start a course of treatment, the better the outcome. So it allows kind of for that just direct access, and if a physician is needed later, they're there. Okay, so for back pain, all you need to do is just strengthen the core. Fact or fiction? Fiction, correct. You need mobility as well. Okay, research supports physical therapy as an early intervention for low back pain. Yes, good job. Okay, so when talking about back pain, there's some red flags, some signs that you need to be aware of if you do have anything of this. This kind of indicates that you should go to a physician to be checked out. So if you have progressive weakness, loss of bowel and or bladder control, if you suddenly are losing balance, fever, unexplained weight loss, a recent trauma, you want to make sure you have do not have a fracture, or if you have severe constant night pain, meaning it keeps you up all night, you can't turn over and get comfortable to fall back to sleep. Okay, so now what? What is the treatment of back pain? How do you treat your pain and your symptoms? What can I do for you, and what can you do for yourself? So in physical therapy or in exercise in general, you should always make sure you're focusing on strengthening mobility of the spine and your joints, flexibility. You want to make sure you're having correct posture. This is when you all sit up tall and correct yourselves. You want to have workplace assessment, so you want to make sure your work is set up right. Actually, most people have to sit all day. Luckily for me, I am on my feet, and I'm always moving. But sitting all day is really bad for the spine. It's actually the worst position for the spine, just because all your weight is going through your spine. So getting up every 30 minutes, if possible, is the best. And modalities, heat, ice, that's sometimes needed. Massage, and then lifting mechanics or mechanics of daily activities, how to do them safely. The thing about the back is it's very individualized. So you may be having some symptoms and your friend might be having the same symptoms, but the treatment to get you better may not necessarily be the same. Okay, so I can't emphasize posture enough. Posture in sitting and posture in standing and posture when you're moving. So I had a slide that shows all people sitting in bad posture, but I don't need that slide because just look at each other. We all sit like that. So why is posture so important? So it keeps your bones and joints in their correct alignment so that your muscles are being used properly. Anytime we're sitting like this, you're getting tight in the front, you're straining in the back. Your muscles have to work 10 times harder because they're not in the place where they like to be. It decreases abnormal wear on the joints that could lead to arthritis. It decreases stress on the ligaments, so that's the same kind of thing. If you're sitting like this, you're kind of hanging on all of those ligaments and they're working so much harder to hold you up. It prevents the spine from becoming fixed in abnormal positions. So like the kids all nowadays are all like this on their phones. They're fine now, but over the years they're going to keep on doing that and then they're going to all be like this over time. It doesn't happen at once, it's a gradual thing. Sitting with good posture prevents fatigue of muscles. At first it's kind of fatiguing and awkward to sit in good posture, but really your core is working so much just by sitting with good posture. It prevents strain and it prevents backache and other muscle pain. So actually from sitting like this for a long period of time, you might start to feel a little pain in your low back. Try correcting your posture and see how that feels. And another thing about good posture is you just look good. You don't look very good sitting there like this. So let's see what my next thing is. Okay, so proper sitting position is 90-90. So I want all of you to do this. So make sure your butt is at the back of the chair and your feet are flat on the ground. Good. And you're in that 90-90 position. Now everyone kind of just put a little arch in their back and see how that feels. Good. Oh my gosh. Wow, you guys look really good now. Good. Yeah, this looks good.
It's very unnatural.
It's very unnatural and we don't do it. So the other thing that you can do is kind of take a lumbar roll and put it in the small of your back. This kind of just gives you that natural spine, that natural curve in your spine. If you don't have a lumbar roll, it's really easy to take a towel, roll it up, and put it behind there. So firmer chairs are the best, but even if you're sitting on your couch, a little pillow there will give you that little support. And it's really good to have just a little towel in your car. That's a place where it's beneficial for you, especially if you're going for a long ride. And like I said, you don't really want to be sitting for a long time. Our bodies are made to move, so 30 minutes and I would say like an hour is tops. Really try to get up and just walk around for a little bit if you can.
So if you're driving a long distance, stop every hour and walk around?
Yep. That's the ideal.
Every 20 minutes you go to the
That's what you have
to So same thing in standing. You want to have that upright posture, keep your abdominals engaged and shoulders back. Sleeping is a big thing if you have back pain. Oftentimes you can't find that position of comfort. In general, the best positions I would say to try would be either on your back with a pillow under your legs or on your side with a pillow in between your legs. This kind of just helps for the natural spine of the natural curves of the spine. Now, as your spine changes, you may need to modify and adjust that because you don't want to be forcing yourself into positions that your spine doesn't go. All right, so the do's and don'ts of lifting. So a lot of people know you have to squat down, not bend. But the one common thing that I find that people do is, okay, so a lot of people, they get the squat, but what they do is they lift and stand all in one motion. That puts a lot of strain on your back and definitely makes you prone to injury. So the best thing to do, always make a plan for your lift, okay? So you have your feet shoulder width apart, engage your core, squat down as low as you can, bring the object to you, and then stand and exhale as you stand. So whenever you're lifting something heavy, everyone plans to lift. They know they have to lift with good technique. It's those little light things on the floor that you go quickly to pick up, and that's when you usually get the injury. So even with those things, still think about how you're lifting. You want to make sure your spine's nice and neutral, not flexed. The other thing, common mistake, is that people lift and twist at the same time. That's another way to injure yourself. I know it takes longer to lift and then turn, but you'll be happy in the long run when you don't get an injury, taking that extra second to do it like that. So when you're lifting, what you don't want to do, bend at the waist, twist, hold your breath, or lift anything that is too heavy. Try to get someone else to help you if you can. So there's different types of lifts too. I know some people also have bad knees, which can affect how you lift. So there's squatting to lift, which I just showed. You can kneel on one leg and lift up like that, which may be a little less straining on the knees. You can do a golfer's lift, which is when you have to have good balance for this one though, but you stand on one leg, come up, and stand, so your back's in neutral. And then for overhead lifting too, you have to be careful with that, because if it's too high and too heavy, you can strain backwards like that. So always using a stool if it's something higher and heavy. When it's above, lift, bring it toward you, and then come down. Okay, so exercise, like I said, mobility of the joint, flexibility of the muscles, and strength. There's many ways to strengthen your core. Everyone should be doing it, but there's a lot of ways besides crunches. And when you're doing core strengthening, you should never have back pain. If you do have back pain with it, you're probably doing something that's too advanced for you at the time. So you need to start easier. And when you are starting exercising, like if you have an injury and you start exercising, the best thing to do to get back into your normal exercise routine is to bring back one thing at a time. So that way you know, okay, did I do this? What was the result after? Was I okay? Can I keep going? Or was that too much? Sometimes when you do too many things at once, then you don't really know what was the cause of the increase in pain. So the main goal of when you have back pain is self-management, just because back pain can be very chronic and you want to know how to decrease the pain or get rid of the pain. So like I said, when you have back pain, it's common to have a reoccurrence. So you want to feel confident that you know what to do. A lot of times when people have a back injury or just reoccurring pain, you get guarded and fearful. You want to be confident in the movements that you do because the body, like I said, wants to move. So there's a greater than 50% chance of reoccurrence with back pain. So when you are exercising, keep up with it to decrease that percent. You want to recognize the signs of back pain returning early so that you can start doing something about it rather than letting it get worse. Don't sit longer than 30 minutes. And like I said, add one exercise at a time on the early stages to see the response. Other things you can do is try to get on a walking program. Keep moving, so try to do 30 minutes a day for 3 to 5 days a week. Make your workstation modifications. Maintain your range of motion. Understand triggers of your back pain and be aware of your posture. Make sure you're performing the right exercises for you. And then seek treatment from a physical therapist or other healthcare provider sooner than later. Okay, that's all. Does anyone have any questions? Okay. Dave?
Getting in and out of the car, I find, is a critical thing when we get older. Well, I found myself putting the one leg into the car, throwing myself into the seat, and then bringing the other leg up. About a year or two ago, I dawned with me, why not turn around, open the door, turn around to the seat, sit down completely, and then bring both legs out and work one at a time.
Yeah, anything in segmental movements, like anything throughout your day is always the best because you want to keep that neutral spine, avoid like twisting and shearing. Now, it's very good to do that, but also sometimes people get a fear of moving too, which is not good either. The spine is meant to move, but it's when you do it quickly, or that's when you get the injuries. Yeah.
You're talking about exercises, okay, to strengthen the core. Are there any exercises you can tell us to do to help increase the strength in our core?
Yeah. So bridges are a really good exercise when you lay flat on your back and then try to lift your hips up. That's really good for strengthening the glutes, and then you can kind of suck it in to engage the core. That's a really good one to start with. That shouldn't be straining on the back. And then another one that you can do, so everyone feel right on the inside of your hip bones, right here. So you have a muscle there, transverse abdominis. So this muscle is kind of forgotten about, but it's really good stability for the back. So the way to engage it is kind of like just, like you're going to cough, or like if someone goes to punch you and you tighten up right there, that really activates that muscle. So if you can find that and activate that, that's a really good core strengthening exercise to do. It's once you get it, it's easy to do when you're laying down or sitting up or standing. Another one that just kind of can start activating the core, and it's easy, it's called a pelvic tilt. But you lay down and you kind of round your back, you push your back flat into the table, so you should feel those abdominals firing. So those are just some easy ones. Yeah?
There's a machine in the gym where you put your knees down and then it goes with your knees.
Oh, yeah.
Is that I heard various things that it was good, it was not good.
Yeah, I don't love that just because most of the time, if you're on it, you might put too much weight, and it is a lot of twisting force on it. I think the best ones are the neutral spine core exercises that you don't have that twisting. Yeah, I don't love that one.
I didn't like it. I was on.
Yeah, no, that's not my favorite. Oh, lots of questions. All right, yeah.
Okay, now, let's assume that you've been doing work, all of a sudden you feel you got a little bit of strain, you're tired. And obviously, other than sitting down, what can a person do? Like aspirin, Advil, what exactly would a person like that do?
So, whenever it comes to medication, you just have to ask your doctor. I can't really give that. But if it's an acute injury, so heat or ice, that's the question, right? So when it's acute, injury, meaning like 24 to 48 hours, you want to start with ice, because that can really help with it. There's an inflammation in there. From then on, heat's fine, ice is fine, whatever makes you feel better.
What I was trying to say is that in most cases we overwork ourselves.
Yeah.
And you get a temporary backache, maybe less a couple hours. Maybe.
Right. So
what do you do right there?
I would throw a heat pack on it, but just keep moving. So if after exercise you have a backache and it only lasts for like an hour or two, that's okay. It's when it's lasting for the couple of days that you probably overdid it. Mm-hmm. Yeah.
If you have a mesh screen in your abdomen, should you still or could you still do core exercise?
Yeah, so you don't have to, like I said, you don't have to do crunches. There's many neutral spine exercises that would be more appropriate. Yeah.
What is the effect of heat or cold?
So in general, cold, that's going to constrict the blood vessels, so you prevent blood flow to the area. So when you initially have an injury, you're going to get a lot of blood flow to it, which causes the swelling, so you use cold. The heat, in general, is going to open the blood vessels, so that's going to bring blood flow to the area. So that's really good if you have like a muscle spasm or just tight muscles. That's going to help loosen them up and bring blood flow to it. And, yeah.
For my idea, if I have any muscle strain, I put heat there because it relaxes the muscles.
Yes.
So I had a friend that went to a chiropractor, and the guy told him he had a problem with his back. He told him lay overnight on an ice bed. In the morning he couldn't even move
He
it.
was probably, yeah, it made him more stiff. Yeah, that's why, it's funny with that. I would just say, like, in general, the first 24, if it's an acute injury, like you did something, you know it's an injury, ice. But from then on, it really is what makes you feel better. You can't go wrong. Yeah. Yes.
For many years, I've had herniated disc in a lot of places in my body. The orthopedic doctors, physical therapy, injections, opioids, I gave up. And the only opportunity they gave me was for spinal fusion, and they told me it's a hit and miss situation. What is spinal fusion as far as you're concerned?
Whether it's a hit or a miss?
Yeah. It can make it worse.
I've seen, honestly, I have seen both. Some people I see they get good relief, and other people I don't see as much.
So I just live with what I have right now. They got shoot.
Yeah.
What about the mattress?
So the best type of mattress that is recommended is just a firmer mattress that allows a little bit of give for the natural curve of your spine. Sometimes when it's too soft, it can give too much, so your spine's not supported enough, or too firm of a mattress can cause, doesn't give enough give. Yes?
When I worked in the post office, and I'm going back at least 25 years when this occurred, they were giving out these vests, you know, for the back to wrap around yourself. I took one for myself because I was having slight problems, and that vest helped me quite a lot. Every time I felt the pain, I put that vest on while I was standing, and a couple of times I wore it out on the job. And it was one of the big things, and it did help me. And I saved it, and I used to spread it around to other people who didn't have it. I said, when you're finished, give it back to me.
You want it, yeah.
And I told him, look, I need it too. And then when I finally retired, I gave it to somebody else. This is why. I know he has a little bit of a back problem. This can help him better.
Yeah.
And I turned it over to another guy, and I had him sign for it. We were responsible for that back. And now I also see a chiropractor. And I thank God my back returns to normal.
That's great. Yeah, that's really good. Yeah.
I had a slight spinal curvature, and they got it back. It took a little time, but it was worth it.
That's great. Yeah.
Just one more question. As you can see, most of us are in that senior stage. We have a lot of habits. How do people overcome? I mean, the way we sit is a habit. Everything we do is basically habits. So, I mean, how do you expect people to make changes that you're talking about? To get people to even start these things and then to continue so that they do have some success?
So, for those of you who have wives, They're good ones. I'm sure they're going to be yelling at you for your practice. Then there's no hope. No, there's different things. So you got to just find tricks and moments in your day when you can. So say you're driving at every red light, check yourself and fix yourself. Set an alarm on your phone for it to buzz every 30 minutes or an hour for a little reminder. Or just find something like, some people do like every time they see the color blue. Oh, that's a trigger, I gotta fix my posture. Things like that to help you remember. But you're right, it really is habit. There's no, I mean, you could be strong, that's great. But if you're just allowing yourself to do like that, that's not gonna do anything. It really is a habit. So just finding things throughout your day that trigger to fix yourself. Yeah.
Other than taking pills for arthritis, what else would you recommend?
So, mobility, like I said, but one of the best things that you could do to just even start to get moving is aquatics. So getting in the water and moving around in there, especially if it's like a warmer pool, which is not here. That really is good for mobility, and you can start strengthening without having like the weight of your body on all of your joints. Yeah.
Yeah, I have a physical therapy program in which we lie on our back, knees together and twist from one side to another.
Yeah.
You mentioned twisting's not good, but that opens the neuroparameter when you go to one side or the other.
Correct. So that's more of a like controlled twisting movement. So that's really good for your back, for the mobility. For what I was referring to more was like when you're doing quick twisting, like throughout your daily activities, or like that machine down there. Yes.
Many of us are dealing with extra pounds. Really? Besides the impossibility for most people to lose weight, are there effective ways of, dealing with that? Some people hold their weight in different parts of the body. Does that affect what goes wrong? So if there's more of the...
Oh, okay. Yeah. I mean, definitely. A lot of people have a lot of their weight here. That's going to put more strain on the back just because it has to support it more.
Are there exercises you can do to sort of help that with those of us who are heavy in the front, those who are heavy in the seat?
Yeah, it's like you said, there's nothing like specific. I mean, you can focus on your core strength to build muscle there to burn out that, but in general, cardio, strength, diet. Not just like healthy eating. Yeah.
What are some good stretching exercises?
Okay, so hamstring stretches are really good to perform. So if you, is there a chair I can borrow? That's fixed. So for your hamstring, so sitting on the edge of the chair, keeping your back up straight, put your leg forward and flex your toe towards you. And you should feel a stretch in the back of your thigh. Now, a common mistake people make when stretching the hamstrings is that they lean forward to try to get more range. But that's not good for your back. You want to keep your back up nice and straight, bring your body forward, and you feel that stretch. Everyone feel it? Yeah. So also when you're stretching, you want to do longer holds for like 30 seconds to a minute. You don't want to do quick stretching because this really allows the muscle to get lengthened. So that's good. Stretch. More?
For the back.
Okay. Well, that helps the back because your hamstrings kind of there. So the back is different because, like I said, everyone responds differently. So some people really respond to a good back bend, but other people, that might cause symptoms down the leg, or might be too much pressure on the back. So you have that as an option when you get up, or gentle stretches when you're sitting in a chair and just leaning forward, getting a stretch in your low back, like that.
There isn't a soul in who can touch their toes other than you.
I can barely.
Hey, here you go. I know.
Okay, one last question. Anybody?
I'd like to make a little comment. Go flying, and I learned this years ago. They tell you to sit up straight, stretch your feet forward, and move your ankles back and forth every so often. This way you get the blood flowing in your whole leg. And this is, I do that every time I fly. And people say to me, how come you're doing this? And when I quit, they try to say, oh my God, it feels good.
Yeah.
And if I tell them, or if you're at an office, like I like to be at, get up and try to walk around if you're allowed.
Yeah, good point.
He's got a resident
As you know, I'm Dr. Wilmer at the Chiropractic Center here at the JCC, and Dr. Sheri, literally every patient that I referred to her and reported back and forth at times, not only think she's very sweet, like very easy to talk to, but they all have improved. And that's kind of what the comment on that.
Sheri,
Thank you so much.
we'd like to present you the certificate of appreciation, and as soon as our resident photographer comes.
Move the chair.
Thank you so much.
Move your chair.
Stand up straight.
Yeah, click this turn my back.
And one last duty for you. 50-50.
Okay.
The winning share is $57. Let's see. I'll take out mine.
Oh, just read the number.
327. It's the wrong number.
What? Yeah. Oh.
You picked the wrong number.
What do you mean?
It wasn't my number.
Go to communication.
327.
All right.
Don't forget, after the meeting, the annex, if you can help out with the food sort. What? What's he checking?
Okay, thank you so much. You're welcome. Good.